I'm going to be talking about evidence-based therapy today, also known as evidence-based practice. And I want to get one major thing clear as a bell. I am not saying that all therapists are failing. The main point I'm going to be making in this video is that therapy as an industry, as well as several individual therapists that I've personally met and worked with for a short time, longer than one session, but still for a time, long enough to know that they were ineffective, are failing. So, no, not all therapists. I am fully aware that there are several people who have been helped by therapy, but there are also many who have been failed by therapists. So we're going to talk about why this is. I just wanted to make sure that I was not going to get taken out of context. So what I'm going to be reading is by the Association for Behavioral and Cognitive Therapies. But first I want to talk about what makes an effective therapist. Intuition with people, humility, vulnerability, and the ability to be creative with how they're going to help the client heal. Now, something that directly ties into this is the desire for their client to have agency. If you have a therapist who has read prestigious books, who has gone to a prestigious school, who has a lot of money, who has a nice suit, a nice upscale office, he or she is worthless unless they want their client to have agency. What do I mean by that? I mean, therapy is a failure if your main objective as a therapist is to get the client back in the office. If that is your main objective, short and long term, you are in the industry for the entirely wrong reason. This is a failure in and of itself because the point of healing is to deepen one's understanding of oneself and the problem, the perceived problem, to the extent that they are able to then help themselves independent of another individual. When I say humility, I mean there is no hierarchy of the therapist genuinely believing that they know better, that they know the client better than they know themselves on the pure basis of where they went to school, how nice their office is, how much money they have, what their name is, who they know, who they studied under. It doesn't fucking matter and nobody fucking cares, because until you have utilized the one human skill of intuition, which is a cut above empathy, because empathy it's really childish if you think about it, and it's really not even a good thing if you're always absorbing other people's feelings. That's like not even that good of an attribute at all, especially with a therapist. It makes someone very ineffective. So what you actually need is intuition, because then you are going to innately know what it is that they need. And it doesn't mean you can read their mind, but it does mean that you can tell whether a client is going to need, it really pertains to what questions they need to be asked and where they need to be directed, and when you are wrong and the client is actually right, because that will happen. And the opposite will happen too. But until there is some sort of intuition that is innate in the individual that's trying to help the client. It's just, there's no book that can tell you how to help someone heal. It doesn't matter how prestigious the psychologist is. Right over here behind me, I have Severe Personality Disorders by Otto Kernberg, one of the best psychologists of all time, in my opinion. He was much better than Freud. I mean, Freud would fucking roll in his grave, you know? What's the politician who said, if Lincoln were still alive, he would roll in his grave? That's one of my favorite quotes of all time. Yeah, and you know, Kernberg was fantastic, but there's not one single book that's going to give you the intuition. Only your humanity can do that, and if you don't have that, then, I have a twig in my eye, sorry, then you're going to be an ineffective therapist. And so, what makes a bad therapist then? Egoism. They're really only thinking about their next paycheck, and they want to hand you a book so that you have to come back in for another session. If you really think about it, any therapist who hands you a book, think about it. Like, if you're told to read a book or handed a book, you're basically, that's kind of like 80% of a chance that you're going to come back, whereas before it would have been like, you know, 30 or something. I guess that would really be up to you to decide that, but it's such a cheap way of doing your job. It's like a professor showing their students a film instead of actually teaching it. It's like, well, you clearly had no idea how to teach this, so that's why you showed us the fucking. And so, anyways, I saw a therapist, and I saw a few, but this one stands out in my mind, right? And this is just a part of discussions, you know? I mean, I can make this completely beside myself, but that would be completely ineffective. So, and also, what's the point of going through anything if you're not going to talk about it? So, I went to see this therapist back in 2017, the end of 2017. I was 18, and just moved back to Florida after 12 years. And I had lived in the same city up in Maine for 10. So, you know, leaving a familiar area is uncomfortable for people. That's a normal thing. And so I was extremely depressed, and I wasn't sleeping at all. I was going like 3 days without sleeping. And so she handed me a book after a few sessions of her talking about her ex-husband. At the first 15 minutes of the session, every single time, she would just, like a teenager, she would just talk about her ex-husband. And it's like, Cynthia, her name's not Cynthia, by the way. I didn't ever tell you that I cared about you. I thought that was your job for me. That might sound callous. I'm pretty sure anyone here would comprehend the fact that you don't really go into a therapist's office caring about the therapist. Like, it's like the last thing on your mind. You're trying to improve yourself and your own life, and that's really all that's supposed to happen. And so eventually, after she refused to diagnose me with anything, which is what I really went in there for, so that I could get proper therapy, there was never any technique or any game plan or any let me design a program for you, right? There was, let me talk about myself for 15 minutes, let me ask you the same questions every session, which is what is going on today. Today is not the problem. We're not talking about today. It's probably slim to none that anyone ever comes into a therapist's office about a problem that involves today. The problem is usually beyond this space and time. And so I don't even remember what angle I took it at, but I usually would talk about the past because that day was not the fucking issue. And then, I guess a month went by, she handed me a book. I read a few chapters of it. I handed it back to her. She didn't want to discuss it with me. within the next session, she ended up just referring me to a psychiatrist. A failure. And this is why. There is a page I'm going to read from that I, talked about earlier, mentioned it, but we got to get this out of the way because it's important. Laying the groundwork, So, this is also my second time filming this, so hopefully this is my last time. Perfectionism is a bitch. So, there's a little, what do you call it? A myth, or like a legend, both of them, I guess, at the same time, about how there are treatments based on research, right, in psychology. And the concept of that is basically, well, here, let me read it. There are so many factors that go into choosing a therapist: location, fees, availability, others. When you're looking for therapy, be aware, not all therapies are the same. While some methods have years of research supporting and providing that they work, others lack this rigorous testing. Research support is so important because studies show that therapists are actually not very good at figuring out what treatments will work based on their own subjective opinion. What's going to do it? AI? Is AI going to do that too? Instead, we know that when treatment is based on research, it's more likely to lead to successful outcomes. In other words, you're more likely to feel better and meet your treatment goals if your therapy is proven to work in research studies. This is the problem, right? People are not robots. So when you treat people like they're bots and you talk about what treatment option is going to be good for them, well, this is an issue, and this is an issue for many reasons. Number one, research is inconsistent because I'm sure after the pandemic and all these things, when people started realizing, oh, gain of function research is actually a really big problem. And I actually talked to some people recently who still didn't know what it was. So apparently it's not as big of a thing as I thought it was. And so when you think about gain of function research, you look at things like cognitive behavioral therapy. Why? Well, that's one of the most popular forms of therapy in the world at all, ever. And, if you don't know about therapy, there's a chance that you've heard of CBT before. So then you mix it with some a pretty big issue that needs treatment like right away, which is non-suicidal self-injury, which is like cutting. And so I tried to find research against, because a well-rounded paper and a well-rounded opinion is based on, weighing the pros and the cons. It's not just reading like one side of the argument. That's not well-rounded. So I myself personally couldn't find the study. I had to go on Reddit, which is how I was really desperate, because I don't like social media at all, and it's the only social media I use besides this. So, treating non-suicidal self-injury, a systematic review of psychological and pharmacological interventions. So it says both studies concluded that adjunctive CBT did not reduce the likelihood of engaging in NSSI compared with antidepressants alone, and may even increase the risk for engaging in NSSI, non-suicidal self-injury. Regarding the supplementation of CBT-oriented treatment with medication, one RCT evaluating DBT and olanzapine, that's irrelevant completely. I don't know why that's even in the same passage. But it says CBT may even increase the likelihood of non-suicidal self-injury. So then, this is like great. And by great, I mean disgusting. If you look up NSSI and CBT, you will find over 15 studies confirming the efficacy. So my question is, why the fuck are we talking about research like it's reliable? Because it's clearly fucking not. All right, moving on. So then, right, so we can't rely on the therapist's subjective opinion, right? So because we can't rely on that, then what do we rely on? We rely on the studies that also can't be relied on, so that's perfect. Solid. So then we talk about how not all therapies are the same, right? Some of them have the individual walk in the office and they walk out the same exact way that they came in, maybe even a little bit more lonely because they heard that their therapist talk about their ex-husband for 15 minutes. Maybe they actually went in the office because they wanted help. Imagine that, right? But instead what they got was the opposite. Okay, so let's get more into that. What do I mean by that? Your values and preferences. This is perfect. The second important component in evidence-based treatment is your own values and preferences, if you're even asked about them. Psychological treatment should be a collaboration that respects your own preferences, needs, and values. That sounds really cool. If that even happened. You should open with your therapist about any concerns you have so that you can address them collaboratively, except they forgot the why. And expect your therapist to take your values and preferences into consideration when making treatment recommendations. You might have specific personal preferences for your ideal therapist. It isn't always possible to find a therapist who meets these preferences and also provides research-supported treatment. Right, sometimes you have to pay $200, $400, $600, $800 before you find the one that's actually going to use methods. You know, after my experiences, the whole I'm so sorry that happened, the whole shit talking about your own life, the whole I like your shoes, and that's supposed to somehow be it. You're not a therapist. After all that, I would actually have some sound advice for you, a person who wants to go see therapists, and you read the title of this and you're like, failure of therapy, what are you talking about? I would walk into the office, and before you ever hand them over your credit card, before you ever open your mouth and say a word about your life, you ask them, hey, Cynthia, do you use methods? Because I'm not just here to chat. I got friends for that. Even if you don't, just say you do, because it's just more dramatic. It's just, funnier. But if you don't do this, you are going to go 4+ sessions. You're going to waste $200, $400, $600, $800. Because I don't know any therapist that charges less than $200 per session. I'm not sure if that exists. Well, if you have good insurance, but I don't even, anyways. You're gonna waste the money, and then you're gonna look in the mirror and say, wow, I must really be a fuck up because they referred me to a psychiatrist and now I'm going on pills that are gonna fuck up my brain for 3 years, which is what I did. So, been off them for a while. Anyways, so, the most honest statement that is made here in this right here is psychological treatment should be a collaboration that respects your own experiences, needs, and values. You can't always expect, I don't even know where it says that. I know it said it somewhere, but it basically said you cannot always expect every psychologist to meet your needs. I mean, yeah, like you can't really expect that of anyone. But at the same time, the fact that I went through 3 therapists that didn't use methods, and this is my first time hearing about how there is a standard of evidence-based practices, and there's over 45 of them There's so many, and they've been, you know, they're pumping them out since probably the 40s or something. And, you know, this is just, you know, it begs the question, number one, why? Was it just because, oh, she may not be a long-term patient. I may not even be paid by this bitch for longer than 3 weeks. So why would I go out of my way to create any kind of plan for her when I could just do nothing and just wait and see if she's going to be consistent, and then maybe I'll consider, you know, coming up with some schema. You know, we're not going to waste our time because we don't know if she's just going to like bounce and then, you know. So there's one possibility. And then there's the other possibility, which is I just don't care enough. I may be a therapist with my degree on the wall and a plaque. I don't know why they do that. It's like super pretentious. Completely irrelevant too. And I'm going to just disregard all the 8 years that I went to school for this bullshit degree that I, you know, am supposed to be using to help people with. But instead, what I'm doing is just absolutely fucking nothing. And I'm going to sit there and I'm going to bitch with them about their lives and then hope that that's enough and hope that that's what people really want from me as a therapist, that they're paying to sit in their chair and talk about their lives. Don't you think that maybe, just maybe, people are not that stupid? People actually want to change. People actually give a fuck about their lives. And people are willing to admit when they're wrong about things. So, when you waste their time, they can tell. And it's not like your best kept secret when you sit there and you act like you have significantly more answers about their lives than they do. That is more ignorant than I could ever emphasize. And when you think that you can use your client as a therapist, as a replacement for evidence-based practice, let me just... Yeah. So, clinical expertise. The final piece of evidence-based practice is that your therapist's clinical expertise. It is your therapist's job to interpret the best evidence from the research in light of your preferences, values, and culture. Therapists rely on their own clinical judgment to figure out how to integrate these different pieces of information into your individual treatment plan. They also rely on clinical expertise whenever the existing research base does not provide enough information to address your situation. A therapist who is serious about engaging evidence-based practice should give the scientific evidence extra weight in designing your care so that you have the best chance to improve. However, sometimes the scientific evidence is lacking or incomplete. For instance, if you present with 2 mental health problems, because they're that quantifiable, right? For which there are 2 different treatments, the existing research may not clearly spell out whether you would be better off starting with treatment A or treatment B. What does it matter? I think whichever one is more severe you would start with. Is that not common sense or what? Number 2. A major criticism of evidence-based practice is that it fails to highlight the imperative nature of revitalizing meaning in the context of one's life. So when a person doesn't have meaning or doesn't feel as though they have value in the scope of their lives, they tend to get very depressed. And this can manifest as addiction, anger problems, depression, a combination of those. and other things too, but those are the main ones I would say. And the problem with that is that it's very difficult to help someone find meaning, because meaning is found in the process of undergoing psychological pain and stress. But the problem is that our society is encouraging addiction, is that everything is based on, and when I say everything, I mean treatments, they're based on reducing symptoms. Well, sometimes you have to show symptoms in order to improve, just like you have to be bad at something in order to be better at it. In order to heal from your pain, you actually have to feel it and stop drinking and stop taking medications. And I'm not perfect. I don't drink, but I take medication. And, you know, for a problem that Prozac caused, which is just fucking wonderful, just don't take it. If it works for you, I don't really care. That's great. But if you don't take it, just don't ever take it. Thank you. Appreciate it. Just, yeah, I really wish I had never taken it. But also, I'm happy I did, and I'm happy I actually went through all of the painful experiences that I have, because now I can have a chance at helping other people who have been through similar experiences to a much higher degree than anybody who has not been through those things. People who have not been through pain or have not acknowledged any pain in their lives are extremely lacking in any kind of compassion, insight, or propensity to help anyone in their lives, whether it's their kids, their friends, anyone, their coworkers, anyone. They can't really help anyone because they have suppressed over a third of their personality. You know, pain is actually there to help us grow, and if you don't feel it, if you don't actually derive meaning from it, because that's the second step in feeling it, is that you need to derive meaning from it, and if you fall short of that, you're just going through shit for no reason. We're not here to constantly feel good, and oh, what's wrong with you? I was told this a lot in my life as a kid, especially. You were in such a good mood a second ago, what happened? Oh, so love is conditional. So I am only lovable when I'm in a good mood. And the only acceptable emotion is joy. I'm sorry, but that's really fucking creepy and weird, and I don't subscribe to that, and I don't think you should either. So when you have evidence-based treatment, if you have something like a severe issue like self-harm, are you trying to reduce the symptoms and slap a band-aid on it? Or are you trying to get to the core issue, and are you trying to help the individual see the innate meaning in their lives, the value that their life as an individual soul has within the scope of this world? This has nothing to do with religion. This has to do with the innate power of the spirit that we all have within us. The power is not external to us in a therapist, in a medication, in an ideology, in a schema. The power is in the literal sense in your spirit. So the more you try to get away from that, the more lost you're going to be. So when you have all this bullshit that's just repeating the same shit over and over, clinical expertise. What kind of expertise are you demonstrating to me when you tell me that you've been to Boston University, you've been here, you've been there, but yet all you can do is talk shit about your husband and ask me what's going on today, and then tell me that I need to get out and meet people when I specifically told you that's not what I want? My psychiatrist then, the one who she referred me to when she didn't want to talk to me anymore, which I didn't want to talk to her either, so it's fine. He asked me as a means of creating rapport, which I fucking hate that word, but we're going to use it anyways. He asked me what my 3 favorite TV shows were, which at the time, that was probably the last year I consistently watched TV. I only watch TV if I'm with someone, but that's like 1% of the time. So I named the shows Mad Men, Dexter, And I forgot the third one. Oh, Archer. Yeah. And then his response as a 45-year-old man to an 18-year-old girl. Ah, broken men. Which is, number one, 100% inappropriate to say to an 18-year-old girl. But also, how dare you think that I'm so shallow that the question that you use to get to know me is based on what TV shows I watch? And also, how dare you disregard all other aspects of me? And I'm not even going to say anything else about that. So, a therapist who is serious about engaging evidence-based practice should give scientific evidence extra weight in designing your care so that you should have the best chance to improve. And then it talks about the treatment A and treatment B. In this case, you should expect your therapist clearly to explain to you how scientific evidence applies to your situation or problem. There are too many contradictions present in research. This is not a reliable manner in which to decide on any kind of evidence-based treatment. Okay. So, the same way that a conversation with a close friend could very much help you, or it could just further distract you into whatever issue you're having. Would you not agree that a conversation, speaking in general, is an art? Okay. Wouldn't you agree that therapy outcomes are so subjective and they're so individual to the person and their issues that they're dealing with? It's so specific and so far from objective or concrete at all, or quantifiable even. It's quantifiable to an extent, but that does not mean it is reliable. And so, would you not say that it's so subjective how each individual reacts to a certain type of treatment that even if you were to look at studies, it's still completely irrelevant because it doesn't speak to how it's going to treat your client specifically. So, in thinking about clinical expertise, you will want to consider the degree of experience that a therapist may have with a specific problem or a particular group of people. Sure, everyone has specialties, but the problem with this is that the specialties really don't mean anything either, because I've looked at several therapist websites in this area that I live in, and every single one of them have 6 or 7 different specialties, and it's fucking pathetic. So that really doesn't mean anything either. I mean, you can't specialize in 7 different things. I mean, that's not even a specialty at that point. So this basically just keeps reaffirming to me that all of this is a lie. And my main question with the concept of evidence-based practice is, who are the therapists who are practicing this, and where the fuck are they? Who are they and where the fuck are they? Because I haven't encountered them. If the tree falls in the forest, no one's around to hear it. It didn't fucking fall because it doesn't exist. Because what the fuck? Who's telling me that the tree fell? I really don't care. I didn't see it. Didn't affect me. That's what nobody fucking says. So, there's another website back here from a less reputable site called Positive Psychology. Nobody even knows what that is, but It basically says, it quotes the American Psychological Association, which is good. Only good thing about it, I guess. The clinical implications of using evidence-based practice in psychotherapy include relying on collaborative decision-making with the patient based on best clinically relevant evidence. Decision-making. I didn't experience that. There was no decision-making when I was in therapy. I guess some people don't like making decisions. Considering probable costs, benefits, and available resources. Using the treating therapist's professional judgment to use methods or to not use methods. Actively encouraging informed patient participation. Participation in what? Problem solving? Individualizing treatment beyond existing research. Wow, that almost sounds like you're indicating that intuition is used in this process. Ongoing monitoring patient progress and readjusting treatment as needed. Well, that would also take a degree of situational awareness. And, that's in a league of its own when it comes to people. So, this would be all well and good if it actually happened. But my question, before my chair breaks, apparently, my question is, for the other 15, 16, 17, 18-year-olds who are going to therapy, as that was me, years and years ago. Definitely not those ages anymore. I don't know why I had to clarify that. God. Let's just pretend I didn't say that. Who's going to tell them? Who's going to tell them that they're going to have to walk into a therapist's office and say, hey, do you happen to use methods? Just hand me a book. We don't have to do evidence-based shit, anything. Just come back so that you can pay me again and I'll hand you another book to make sure that you come back and return me the book. Let's just do that. It's fucking pathetic. Y'all should be fucking ashamed of yourselves. If you are a therapist who is watching this and you think that people who don't have the same degree as you don't have a right to talk about this, I don't think you have the right to even be a therapist if you're not actually doing anything except for talking shit and saying, oh yeah, they sound really fucking annoying anytime your client talks about the people in their lives. You know what that's called? It's called enabling, sweetie. It doesn't have to do with drug addiction for it to be enabling. You can enable bad behavior. So you got a degree to enable bad behavior. You got a degree to act like a salesman and make sure you come back so that you can pay my bills. I don't want you better. It's not in the therapist's best interest to have independent clients who are aware of their agency. And it is very depressing. I can tell you that the best thing, and this is a whole separate thing that I'll talk about at some point, but being in solitude helped me more than anything. Meeting people that are not very common. I only really know one of them, and I'm very lucky to know him. But knowing people who, without even trying, make you want to be a better person, and they make you want to self-actualize because it's not so scary being vulnerable anymore. That's more powerful than having someone treat you like you are a science experiment, but also they're a salesman at the same time, technically, because if they don't get you back in, that's making a sale. Like, getting you back in as a client into their chair next time, like, that is making a sale. It's the same thing. It's just that the terms are different. The circumstances are different, but it's the same exact thing. Don't ever forget how powerful and boundless your own mind and spirit are. Don't limit that. Don't convince yourself that they are limited and that they are contingent upon another person's level of education. Because regardless of how much you may be lying to yourself now, there is a reserve of information that is accessible to you when you do allow yourself to face it. Because it doesn't have to be terrifying, and it doesn't have to make you break down. It will make you change once you face it, but it should not make you break down once you see it. It is always there, regardless of how much you've been lying to yourself. And regardless of how alone you think you are, you're not. I think a conversation with another person is an art. To be able to listen is an art. To allow oneself to be quiet long enough to see the process of a person slowly build trust with you and become comfortable, and then in that quiet they will self-actualize. Acknowledgement of the core issue does not have to be terrifying, but it will be if you keep slapping band-aids on the cut and you think that it's just gonna keep doing the trick without actually getting rid of the bacteria.